I mean, I heard a figure for England last week from a very reliable source, and it was suggesting that around half of the patients who are in hospital with COVID just now in London, big number of them, didn't know they had COVID before they went in. Would that roughly correspond to what you're seeing in the figures that you're seeing but we're not at the moment in Scotland?
Look, it's really better that I don't give out management information that hasn't been published by Public Health Scotland, because we've got to make sure that data is good. Yeah, sure. But I can understand why you're asking the question. It's why we're looking to get that data published, which is not an unreasonable request at all, as soon as we possibly can.
Yeah, because it's a big deal, isn't it? I mean, almost 700 people in hospital with COVID in Scotland today, but you're making policy potentially on the basis that only 350 of them, if the 50% thing is broadly in the same ballpark as it is in England, only 350 of them are actually struggling with COVID, and that's the reason for them being in there. It's a very different set of figures you're working with than the ones we're being fed.
Not entirely. You also have to remember that, Omicron has not been with us for terribly long. It was always going to take time to work through the detail and see the trends associated with Omicron. You couldn't just pick up South African data and transplant it to Scotland, where we have a very different demographic, different levels of vaccination, etc. So there was always going to be a period of time, I think, where you've got to quite rightly take a very cautious approach. What we're trying to do is balance those risks of harms. I think we've got that balance right. We'll keep it under regular review, but constantly we're asking the questions, many of the questions you're asking, we're asking, I promise you, even more questions of the data from the analysts and the stats people as best we possibly can to inform those judgments. And that's why we keep those protective measures under constant review.
Answer me this if you can. Are any of the 36 people who are in intensive care units in Scotland tonight, are any of them there specifically and exclusively because they are suffering, they're gravely ill, exclusively from the symptoms of Omicron?
Yeah, and again, I understand why you asked the question, Martin, but look, given such small numbers, you would understand why I wouldn't go into the detail.
I'm not asking for their names. I just want to know what this variant is doing to people. Is it extreme enough, even in some cases, and in just a few cases, to put you on death's door? Has anybody died exclusively from Omicron in Scotland yet?
Yeah, again, Martin, when it comes to that question of ICU, you have to remember in some health board areas, there's literally just a few people in ICU or a couple of people in ICU with COVID. So it would be wrong for me to give that level of detail. But I do promise you, as soon as that data is quality assured, we'll make sure it's published. There's no reason the government wouldn't want to publish that information. We just have to make sure that data, as I say, is absolutely right, quality assured and accurate.